Welcome. My name is Corinne Waldow. I'm the Economic Development Director at the Boulder Chamber, and I want to thank you for participating in today's call, our ongoing effort to try to get your questions answered and provide you the information you need to have a safer reopening. I want to thank all the participating chambers in Boulder County and economic development authorities for sending out this information and getting our businesses engaged in this process. And I want to thank Boulder County Public Health for providing these weekly times for you to be able to ask your questions, get answers, provide feedback, and so forth moving forward. At this time, I'm going to hand it over to Zach Swank with Boulder County Public Health.
Thanks, Corinne, and thanks to the Boulder Chamber and all of our economic partners across Boulder County for continuing to help produce these webinars. Obviously, this is the retail section today. And Angel, if you'll advance the slides. Great. So we're going to go a brief overview of the face covering order, safer at home. We'll touch on that briefly, and we'll cover some common Q&A questions that have come up in previous sessions, as well as resources to support you. And then we should have plenty of time for your questions towards the end of the session. Please use the chat feature, or excuse me, not the chat feature, the Q&A feature, and we'll take your questions that way. So this is for everybody you see on the page here, not limited, obviously, to those sectors, and it is not limited to retail. It is not for retail food, which has its separate session on Tuesdays. Yep, so great, thanks, Angel. So, as a reminder, we are under Safer at Home with with the addition of Boulder County's face covering order, both of which go through May 26th. But, long term, it's good to keep in mind that we are going to be with some version of restrictions on our society, on our businesses, until we have a vaccine, treatment, or herd immunity. And that is likely going to be months, as we all know. Also, it's good to remember that Safer at Home will evolve. Governor Polis has announced that he will have an update on or before the 26th of this month about that. But you can expect that it won't be going right back to where we were in January or February, but it'll be a different iteration of what the current order is, depending on how good we all do at keeping down the spread of the disease. So Boulder County's local face covering order, just as a quick refresher, if you are outside your residence and you are not able to maintain 6 feet of distance from others at all times, you're required to have a face covering, except if it's not safe for safety or medical reasons, if you're alone, or for children 12 and under. And it's also important to note that there are instances where the state Safer at Home order is more restrictive than Boulder County's face covering order. So for example, personal services, a barber, customers would not be able to remove their masks, even if they were alone in, the barber shop, for example, because the state's order does not have that exemption. And we are currently working on producing a sort of a matrix of the common scenarios where the orders overlap and overrule each other, and we will share that out with our partners, the Boulder Chamber, when that becomes available. So what is Safer at Home? Critical to remember that the disease is just as contagious as it always was. We need to continue to stay at home and stay physically separated as much as possible. That's one of the best things we can do, and helps determine how quickly we can continue to reopen our economy or not. As you all know, with Safer at Home, it's open with restrictions. It's new territory for all of us, having to limit the number of customers in the store, having to, confront and communicate with customers about, not having a face covering and needing to have one. Certainly that's new experiences for everybody. And also as a reminder, there are still some high exposure risk businesses that are not permitted. And with that, I'm going to turn it over to Angel to walk us through the rest of the presentation.
Great, thank you, Zach, and thank you, Corinne from the Chamber. We're so happy to have you guys here. I know that you guys are taking time out of your day to walk through this with us. So we went into the checklist a little bit more in previous sessions that are recorded and on the Chamber site. So I'm not going to go fully through the checklist, but we want to let you know that the compliance with the Safer at Home order is mandatory. So that's not something that you can pick and choose. We developed the checklist as a tool to help you. So use of the checklist is voluntary, and it's a compliance aid for you so that you know what is required of you under Safer at Home, and then also give some tips on best practices. It's also a communication tool that you can use it, check it off, post it in your store if you'd like, and then print off a poster that Corinne will show you perhaps a little bit later, showing that you voluntarily went through the checklist that Boulder County has created. And then also you can find more information about the checklist on this bouldercounty.org COVID-19 business page. And we really have all of the checklists for all of the industry sectors. So we do want to talk a little bit about enforcement. So we're asking you for voluntary compliance. It really is your responsibility as a business owner to comply with the Safer at Home order. And we do have a complaint, a report hotline that members of the public call into and tell us about violations that they see out in the community. And so we do follow up with those businesses, and we really are taking an inquiring first education approach to it. So when you receive a call from us, really we're there to partner to help you understand what is fully required of you. If we have issues and we can get continued reports after we've reached out and given you the resources that are needed to comply, then we may ask you to go through the checklist and verify that you have been implementing all of the procedures that are outlined. And in extreme cases, we could create an order to close or have civil action. And we just want you to know that this is something that is for the health of everybody, and we're in this to partner with you to help you be compliant in this, but it is your responsibility. So one thing that we'd like to say also is that Boulder County Public Health can't provide legal advice. Compliance with the Safer at Home order is mandatory, and you are required to. We will work together to comply with standards so that everybody has the same standard guidelines, and we'll try to supplement or change guidance as needed depending on what the current situation is. If you have additional questions about compliance, we are encouraging you to reach out to an attorney perhaps. I know that the Chamber just provided a webinar that was mitigating your risk, so I'm sure that's going to be available. A recording of that will be available. But really it is on you as an establishment to make sure that you're complying with these state orders and county orders. So I'm going to address a couple of our common questions and answers that we've had over the last couple of sessions. One of the biggest questions and gray areas that we've had to do with cleaning retail products. So we did create a checklist or a list, a paper that I'll show you, basically outlining the guidance on retail products. But in particular, clothing. We kept getting a lot of questions about clothing. And our safety expert basically wanted me to underscore that the primary transmission for this disease really is person-to-person contact, but we need to be safe and limit risks. So for clothing in general, the Safer at Home guidelines basically says that you can limit or put restrictions on returning products, and that any employees that handle returns must wear PPE. But these are some additional recommendations that Boulder County Public Health has put together. So another thing that I do want to say, because we did get questions about UVs and steaming, is the literature and the research out there is somewhat limited. So I'll talk you through like what we're recommending as far as best practices. So first of all, we recommend that retailers limit their risk. And you can do this by limiting or even prohibiting returning clothing or trying on clothing in the store. You could implement something that is basically, if you touch it, you buy it. Also, if you are implementing curbside procedures where people can call ahead and order, that really does limit your risk as well, because your employees are touching those items and collecting them up for purchase. So we do encourage you to continue with curbside as long as you can. It is a best practice. So we basically encourage you to disinfect any hard surfaces that have been touched. And then we're recommending that you quarantine products. So if something is a hard product and that has been returned, quarantining it for 7 days is best. Same with clothing, and just keeping in mind that those hygiene procedures are really important. So if you have an area where clothing is being quarantined for 7 days, if you put something else on top of it at the end of the day, then all of those clothing items would be will have to be quarantined for an additional 7 days from the last one that you put in there. So just keep in mind that if you have your clothing quarantined, separate it based on the timeline of when it went back into circulation, or when you want it to go back into circulation. Because if you had a shirt that was returned last week and you're getting near the 7-day mark, and you put something on that and it comes into contact with clothing that may have been just returned today, then that timeline starts over because there could potentially be contamination. Also, laundering is an effective way to clean clothing. So this is probably not effective or applicable to retail agency or retail organizations that are selling clothing, but it might be applicable for thrift shops. I know that we've talked about thrift shops in the past. So laundering is an effective way. You don't necessarily have to go above and beyond just washing the clothes for it to be an effective cleaning tool. Also, what we're encouraging you to do is to communicate your practices to your customers. So to get ahead of it and really prevent those potential conflicts and make sure that people know when they come into your store that you have these set procedures in place. Also, our safety team strongly discourages any use of steam or UV light. I know that on the last few sessions, we have had a lot of questions about steaming. And again, the literature and the research really is quite limited in this. If you do steam, then they were talking about commercial grade steamers. You can't just spritz it with a steamer and think that it's sufficient. So we strongly discourage you from going that route. And also UV light is not good for a lot of the fabrics or a lot of the clothing. It's not suitable for clothing disinfectant, so we discourage that. So if you have any questions, I will go over this sheet that we've talked about here in a minute, but please put them in the question and answer, as Zach said, so that we can respond to it in real time.
Angel, can I chime in just a little?
Yeah.
So just a little more background and context for the slide that Angel just reviewed and the document she'll show later. Please understand that the science of this is all evolving, and the recommendations we've put together are based on the best information that we've been able to find. They are not necessarily guarantees. For quarantining, 7 days per the CDC is best. Other studies show 3 to 5 days. And that COVID lasts longer on hard surfaces than soft surfaces, but there's such a variety of surfaces out there, it's hard to say. So our recommendation is 7 days are best. I would say for hard surfaces a minimum of 72 hours, for soft surfaces a minimum of 48. But again, the science really isn't settled on this, and so what we're providing is the best of what we've seen so far. And then another note on steam and UV, it's not that those techniques can't be effective. They certainly can be in some instances. However, they need to be properly done with proper equipment beyond what you're likely to have on hand or be able to build in your garage. So that's the reason why we discourage them, not that they couldn't be effective, but just that, verifying that they are effective and that the procedures are being done correctly is going to be time and cost prohibitive to you compared to some of these other methods.
Yeah, thank you, Zach. And again, quarantining is the cheapest way to go, and then probably the simplest way, and versus investing in a big steam closet. So a couple other questions that we've had over the past couple weeks are the issues with dedicated in-store hours for vulnerable and at-risk individuals. That is required by the Safer at Home order. So you do have to have separate hours when older adults, people over 65, people with compromised immune systems, pregnant women, when they can come in and shop outside of the regular business hours, or outside of the regular hours for the general public. Additionally, another issue that we continually are either getting complaints about or questions about are really maintaining that social distancing in small stores and separated spaces. In particular, garden centers have been an issue in the past week, and a lot of that's because people are staying home more and they want to garden. So we want you to understand that it is your responsibility to ensure that your customers stay 6 feet apart. I know it's hard to do, but if you can think about possibly setting up the flow of the traffic within your store a little bit better to ensure that separation, that will be helpful. For example, if you have an internal entry into a smaller separated area for a garden center and an external, you might want to consider closing that internal entryway into the garden center. That way you can really meter the number of people who are going into the garden center and ensure that there's not overcrowding. What we're finding is that larger stores that maybe have mixed areas, like a hardware store with a garden center type, they might be metering going into the store and calculating that that capacity based on the entire store area. But a lot of people are wanting to be in that garden center. So it is your responsibility to ensure that there's not, that garden center is at 50% capacity and that people are able to maintain social distancing. We understand that this is challenging because there is some personal responsibility in this, but really this is for the safety of everybody. And we want to be able to continue to have businesses open, and these steps, maintaining social distancing, is what is going to allow us to continue to remain open and not increase the number of cases that we have. So I'll show you, navigate a couple sites here. So I'm gonna first go to the Boulder County COVID-19 business page and just remind you where the curbside checklist is, because we are encouraging you to continue with curbside. And then I'll also point out that document that Zach and I were just talking about. So let me go ahead and pull that up. So this is the bouldercounty.org webpage, and you'll see these.
Still on the presentation, you'll need to unshare and reshare that page.
Thank you. Let me go ahead and thank you. Okay. And I will go to a couple different pages, so let me know if it's not following me. I've shared my whole screen. So at the bouldercounty.org webpage, you'll see some of these banners up here. What you're really looking for to get to the business page is this blue one in the middle that says COVID-19. So you can click on that, and then it will bring up the COVID-19 page. We do have these accordion drop-down areas. You're looking for the guidance for Boulder County Safer at Home. And then under this area, we have some Boulder County guidance tools. This is where you'll find the cleaning and quarantining checklist or guidance that we've provided. And then you'll also find the guidance on curbside as well. So we'll go ahead and pull this up, and I'll make this a little larger for you. Really, this is just references, and it has links to the CDC recommendations. And again, as Zach was saying, that on hard surfaces, 3 to 5 days is what studies have shown COVID can survive on hard surfaces. And then we talk about right here the retail product requirements. So this is really that minimal guidance, or those requirements that was outlined in Safer at Home, that talks about cleaning practices and then what's required. So you can restrict your return policy so that you can only accept things that can properly be sanitized for resale, and then also providing PPE for your employees that are managing those deliveries and returns. And a lot of this can be is going to be duplicate of what you will find in the retail checklist, but the full checklist can be linked to in this document. Additionally, these are the recommendations that we have. So again, this is kind of outlines a little bit more in detail why we are discouraging steam and UV light. And again, those are really probably more expensive options because you can't just use a regular steamer in order to use that. So these guidance right here is really what I went over in that presentation. But as Zach was saying, hard surfaces, it can last on hard surfaces for 72 hours and soft surfaces for 48. So this was the item that I was talking about with the quarantining together versus newly quarantined items. Make sure that those are separated so you don't have to start your timeline over. I know that we've been receiving a lot of questions about this, so hopefully this is a useful tool for you. And if you still have questions after you are able to examine this, this guidance, please let us know, because we want to make sure that it really is an effective tool for you to use. So,
Angel, we did get one question related to this, which is,
okay.
Can clothing that was tried on hang in the same room but not touching during the quarantine period for the clothing?
I would say yes. I mean, I think since droplets really is how this virus is being transmitted, if it's not touching, then you're not in danger of having that virus be transmitted from an old item or a new item to an older item that is being rotated back into circulation. Do we have any other questions?
We've had a few retailers close off one of their changing rooms or their try-on rooms in the back and just closing that off to house the clothing for the quarantine time.
Yeah, that's really great. Best practice.
And it really is, as Angel said, it's the physical contact that's a concern.
Yeah. And again, I mean, when we talked to our safety team, they really wanted to underscore that, I mean, this virus is transmitted mostly person-to-person contact and like people touching their face and then touching door handles or something like that. So we really are just trying to like limit our risk and mitigate the possibility of transmission here. Additionally, on this page, you will find some guidance that we have on other sectors, other areas. The social distancing calculator, when I was talking earlier about those garden centers, the issues that we're having with garden centers and overcrowding there, look at your garden center area, and you can use this calculator to really find out those sub areas within your establishment. What are the maximum capacity for those? And we do understand that this is uncharted territory and that it is difficult to maintain that 6-foot social distance. So we also have like the PPE guidance and then outbreak guidance. We didn't talk about this too much in the PowerPoint presentation, but there are in the checklist, which is here, there is a requirement for you to have your employees screen themselves or screen your employees and basically refer those symptomatic employees to the CDPHE symptom tracker. Just keep in mind that if you have 2 or more outbreaks, then Boulder County Public Health needs to get involved, and there is that guidance that we had on this sheet for what to do if you have 2 or more employees that have tested positive or symptomatic. So this is the the retail workplace checklist, which we've went over in previous sessions. Just keeping in mind that now, as of May 9th, all of the previously defined non-essential, non-critical businesses are able to be open. Well, not all of them, sorry. A lot of the retailers that were deemed non-critical prior to May 9th, now in Boulder County, you're able to operate. But we still are highly encouraging that curbside delivery and best practices, so we'd have that listed as well. Let's see here. Additionally, I think that I've covered those. Are there any other resources, Zach, that come to mind that I should review before going back to the PowerPoint?
No, I
Once
think
you
that's
go
great.
through the script on talking about masks,
Mhm.
Yeah, that's great. Can you see, what are you seeing right now?
we're seeing your PowerPoint.
Awesome. Okay. So I will go back here. Again, this is just the regular Boulder County webpage. Go to COVID-19. That's where all the guidance is. Scroll down to the Safer at Home. And then we have, let me see if I can find that script. There we go. So we have this handy script for you. We know that there's a lot of not apprehension, but there's a lot of fear around forcing your customers to wear masks. And we don't want to put you in a situation that's going to be harmful for your employees. So we have developed a script that basically walks people through how they could say it. And we would recommend that you practice this before you actually are confronting a customer. But you really want to take an inquisitive standpoint. You don't want to assume and kind of be harsh right at the beginning, but you can ask them if they have a face covering available to put on, and they'll say yes or they'll say no. So this is just kind of a flow chart that will walk you through options that you can say. So if they say, yes, I have one, they say, yes, I have it available, then you can ask, and if they say that they have a medical reason why they're not allowed to wear it, we don't want you to necessarily dig into that. We don't want you to be like an inspector trying to figure out like what their medical condition is. We want you to honor the Americans with Disability Act. And if they say that they have a medical reason, then that's where that conversation should stop. There are many reasons why people wouldn't necessarily have to wear a mask. One of that is they're under the age of 12. And we had talked about this a little bit at a previous session, the personal services. Just keep in mind that when you go into different sector types, that there could be different mask and face covering regulations and restrictions. So for example, if you're taking your 11-year-old to go get their haircut, it still is required that your 11-year-old wear a mask, even though generally speaking in the retail space, people under 12 don't have to necessarily wear a mask. So if they say, yes, they have one, you can say, great, thanks for putting one on, or thanks for bringing one. And then hopefully they would put it on at that point. But if they say no, then you can kind of dig in a little bit more, and you can say, unfortunately, I don't see that you have a mask covering. Or you can also offer one up. You can, if you have extra there, disposable masks, you could say, well, here's a disposable mask for you to use. Again, if they say that they have a medical condition, you wouldn't want to get into that too much. So you can also just say, you know, please come back when you have a face covering, or you can say that, you know, it's a Boulder County requirement to have a face mask. Or a face covering. So this is just a tool. Again, this isn't going to be the exact script that you have to use. It's just a tool to help you prepare and kind of role play and go through those scenarios where you have a customer who doesn't have a mask. Okay. So I will click on the space calculator again. I know I did it last session, and it will be a download. It's an Excel document. And it's a pretty simple Excel document, and it's a starting place. We don't want you to think that the number that it spits out is perfect as far as what you see. Can you see the space calculator? Okay, great.
Yes.
So let's say that your garden center is 1,000 square feet. And you enter this in the top here, and then it's estimated percentage of floor space occupied by such other items. So this is where all of your flowers, all of your racks and everything. Let's say that 50% of that is occupied by all of your flowers and your goods that you have. Your maximum capacity for this square footage is 14 people. For them to be able to maintain that 6-foot social distancing. Keeping in mind that this is going to include your employees as well. So if you have, you know, 2 or 3 people in there, then let's say that you have 3 people who are employees, that means that the maximum number of customers that you can have in there is 11. And then all of those, all of the floor markings are also good to have. So you have like one-way aisles. If you have aisles, it's difficult to assess because I know the garden centers might be set up a little bit differently than aisle format. But we still want to make an effort to remind people to remain 6 feet apart. If you have a PA system where you can remind people, that's also really good to just remind people that we know that you want to do your gardening or whatever, but please maintain that 6-foot social distance. Another thing that I do want to say about social distancing and masks is if there are people who can't wear a mask due to medical reasons, you can encourage them to come back in your hours for vulnerable populations. But if they choose not to come back during vulnerable populations hours, then you can also encourage them to remain 6 feet apart from everybody else, because really that 6 feet is really what's going to protect people. So again, the COVID-19 page for Colorado, this is where the Safer at Home guidance is. We have retail specifically here, and this will outline all of the checklist. Basically, all of these items are included in the checklist, but as the state, if they do update the guidance that they have for retailers, it will be reflected here on the Safer at Home retail site. And they also have an FAQ that is really useful. So you can look through this FAQ, and it's basically another accordion and drop-down menu, and you can look to see if there's anything that's applicable to you that maybe we didn't cover or you haven't seen covered before. So additionally, one thing that I didn't cover in this session is that if you have an employee that has somebody that they're caring for that is a vulnerable population, they can't be forced to come into work. So also the Chamber has been a huge ally and partner in this, and they have a lot of resources. And Corinne, you might want to go over those posters that you all created, but also just keeping in mind that the cities also could be a resource for information, any industry associations that you have. We will be offering these sessions weekly. So the retail session here is on at 2 p.m. on Thursdays. Keeping in mind that if you are one of those markets or convenience stores, that your items will be covered under food service. So you can go back and look at those to see if there's any applicable information to being a convenience store. Additionally, we know that some of the personal services might have overlap with retail. So if you have a mixed establishment where you have some retail and some personal services, definitely check out those personal services so that you can be prepared to comply with both sets of those orders. And then we have a Spanish session that's on Wednesdays at 6 p.m. And again, those are being recorded so that you can re-listen to them or rewatch them. And the Spanish session really was well attended last week, so we're happy to see that. We do have the COVID biz at bouldercounty.org that you can submit questions to. Again, our capacity may be limited just because we are ever adapting and we are receiving complaints and calls that we need to respond to, but you can also call our call center if you have questions. So Corinne, I don't know if you have any other questions that were put in the Q&A section.
So I have a question. I'm just trying to get clarification on it. We get a lot of questions from retailers who are concerned that they see people walking in without masks, even though it is a Boulder County order, and they're worried about someone who doesn't, believe in masks or, might become a little bit more belligerent. What do you do with that type of customer?
We don't want you to put your customers or your employees in harm's way. So I would contact law enforcement and let them know, let them handle the issue. Law enforcement probably is not going to have the capacity to come out just for mask enforcement to enforce the public health order. But if somebody is becoming belligerent and somebody is trying to kind of look for a fight, that's not something that you should take on yourselves. You should definitely call law enforcement to handle that situation. And I mean, it is your establishment. And so, I mean, you do have the right to refuse service to people who are not wearing masks if it's not for medical reasons. But again, we want to caution against that escalation when it doesn't necessarily have to be that.
Okay. And then are there certain areas within maybe a retailer that you seem to forget maybe convening spots? Things that you should think about, like bathrooms or break rooms, or what are some of the things you need to do in those areas that you don't even think about?
Yeah. So whenever you have a tight space where people can potentially come closer to than 6 feet, signage is probably a great option, right? Just setting up those clear boundaries of before people go into a hallway, basically having a sign there at the beginning saying stop, check for people, check to make sure there's nobody else. Any place that is high touch, you're going to want to increase frequency. And I know we talked about this a little bit more in depth in the previous sessions, but just think of all of those high touch areas like doorknobs, baskets, carts, the counters. You do have to have plexiglass between the cashier and the customers. And even if you do have plexiglass in place, your customers or your employees are still required to wear a mask. We did have a situation where we got a complaint because the employees were behind the plexiglass and they didn't think that they had to wear masks, but the 2 employees were still behind that together. So it's still a safety precaution for your employees as well, for them to wear masks, even if you have that safety and its requirement, even if you have that plexiglass in place. So again, I think that clear communication is really, really essential. If you can have somebody at the front door saying, we're really trying to maintain 6 foot social distance, please pay attention to the arrows that are on the floor that guide you, like which direction you should be following. That's a great example. Or if you have a PA system to really remind people. These are challenging times. Everybody is really hoping and wanting to get back to normal, but we have to realize that, again, the virus is just as deadly as what it's been in the past.
Okay. I got clarification, and we actually had several people ask this question.
Mm-hmm.
Does the designated time for vulnerable populations have to be a certain length of time, or is an hour a week sufficient?
I'm not sure. I think an hour is week, but an hour a week, or I think that's fine because I've seen that like Tuesdays on some stores, but let me go double check. I haven't looked at it that closely. Zach, do you know?
Yeah, the order does not go into that level of specificity, just that it needs to be provided.
And then we had the question, can curbside replace these hours?
No, it cannot. It cannot. So basically the main text of the order doesn't, it says hours for vulnerable populations, but it doesn't go into the nature of it. But if you look at the appendix of the order, where it goes more in depth for retail, it specifically says that it needs to be in-store hours for vulnerable populations. So you can't necessarily have a separate service just like curbside for vulnerable populations and allow other people into the store throughout the other time. So really it's setting up that hour maybe at the beginning of the day, and again, looking to grocery stores and looking to those businesses that were previously critical, that have established these procedures in place before, the other non-critical businesses were able to open. That's really a good best practice maybe, because they've already set up those hours, maybe on Tuesdays from 7 to 8 or 7 to 9 when they first open. So really it needs to be a separate in-store time.
Okay, I'm going to share those signs. Those sign resources, because one of the questions we're getting from a lot of retailers are, what's the best thing I could do, and education is part of it. And we also provided these signs as a resource for you to be able to put out, and they're common across businesses throughout the county, so that helps to kind of shelter yourself just a little bit and show that these are the rules. So here are the links on all of the emails that I've sent. Include a link to best practices in English and best practices in Spanish. And these are signs including wear a mask, avoid grouping, social distancing. In the bathrooms, wash your hands, stay 6 feet apart. We got a request to make a more stringent sign that says "Do not enter without a face covering." So we'll offer that if you would like something that says that. We do have one here that says "Open for business," and this is basically your self-certification that you are following the requirements in the checklist, and show the public that for the health of the community and for our economy, you are doing what's best for public health. And it says, "I'm following Boulder County and the state of Colorado requirements." And we've provided this to all the chambers and all the businesses throughout Boulder County that you can put out as kind of an assurance to the public. Again, these are in Spanish. I've gotten several people reach out to me and said, "I don't have anybody to translate." We got these translated for you, so do not worry. Those are available, and they should cover most items, including the by appointment only, no walk-ins, call at this time. The only sign that's not in here is the space or the limitations or how many people can come in. At that, I don't see any more questions. So Zach, do you want to talk a little bit about the face covering survey that you're going to be sending out?
Yeah, so we're trying to better understand how the community is complying with the face covering order and how it is going for businesses. Also, we're trying to better understand the degree to which physical distancing is being maintained in a retail environment. So look for an email coming from Corinne with a survey tomorrow where we'll be collecting that information. And what we're going to do with that is look at, how effective are those measures in achieving the desired goal? What additional feedback do we get from you and your fellow businesses about, the challenges of implementing those and enforcing those in your businesses? And from that, we'll use that to inform any future changes to Boulder County's face covering order, as well as what guidance and support we provide back to you for helping to maintain both physical distancing and face coverings for customers and employees.
Great, thank you, Zach. So seeing as we don't have any more questions, I'm going to close the session by thanking you for participating, for asking your questions, and for continually getting the information you need to safely reopen. Again, I want to thank all the chambers and economic development agencies, the cities, for really getting this information out to businesses. And I want to thank Boulder County Public Health, Zach, Angel, and Cami on this call for providing these hours every week. Again, every week at 2 o'clock, and this will help as orders change, as new guidance comes out. We'll be able to provide the update. You'll receive a copy of this recording and all the resources mentioned on today's call. I hope everybody has a wonderful afternoon. Stay dry. It looks like it's going to start raining, and we'll see you next week.